We're going to talk about gynecomastia and gynecomastia repair. So what is gynecomastia? Gynecomastia is essentially when there's a growth of breast tissue in a male patient. So every person, whether male or female, do have some breast tissue, but in males it doesn't grow much. But in certain conditions you can have growth of breast tissue, whether in one side or both sides, that can be bothersome and might not look aesthetically pleasing to you, and you might want to have that addressed. We address that issue in a multifaceted approach, so we usually start with some liposuction. That usually works great, especially if the growth of tissue is mostly fatty tissue, and it can get rid of some of it or even all of it, and it might be the only solution that you need. It also helps you position what we call the IMF, which is the fold underneath the breast. If it's too high, it can lower it and give you a more aesthetically pleasing look. In certain conditions, the growth is actually more fibrous and it won't go down with the liposuction. In that case, we have to make an incision, and usually it's done around the areola. It's usually well hidden, and we go in there and we excise the extra fibrous breast tissue. In certain individuals, the removal of the fibrous breast tissue and liposuction might not be enough because they might have a lot of lax skin. In that case, we might have to do some skin excision. That is done through incisions that are well placed, that will give the chest a more masculine look and will be more aesthetically pleasing. We might also have to move the nipple and the areola, potentially through a free nipple graft. Whatever the case is, we're always happy to see you in a consultation and discuss your options further.